Hello, welcome to Medicare 101 Get the Basics, presented by Benefits in Action. My name is Ron DeVries, and I'm glad to be your host today as we explore your Medicare options. Our agenda today is to cover the who, what, when, where, and why, how, and how much of Medicare. We're going to briefly cover Medicare fraud and abuse at the end and offer you some opportunities to reach out to Benefits in Action and others for questions and comments that you may have about this presentation and about getting help with your Medicare journey. Benefits in Action is a not-for-profit organization dedicated to supporting our diverse community with a focus on older adults and the underserved to improve their understanding, access, and utilization of food and health-related benefits to enhance food security, health, and their overall well-being. Benefits in Action accomplishes this through three major programs: application assistance, navigation, and education. Our motive is to increase benefit literacy, understanding, and utilization of your benefits. We do this through business to consumer presentations on a one-on-one basis with appointments with our navigators. We do a lot of Medicare 101 presentations and Connect for Health presentations throughout the community. Retirement planning is a regular part of our business to consumer presentations, as well as utilization of SNAP resources. We also do a great deal with staff from other not-for-profit organizations and for small business owners to help educate them as well. As you can see here, we have a great deal, a huge number of different programs that we provide assistance, navigation, and application assistance for. It is our hope that by addressing some of the social and economic factors that represent the largest portion of the social determinants of health, we can affect by spillover some other of these social determinants like health behaviors, clinical care, and the physical environment. There are many opportunities over the next month or so for you to seek out this education, either one-on-one, working directly with counselors in various locations throughout the community, or virtually any day of the week. Let's talk about SHIP. SHIP is an acronym associated with the State Health Insurance Assistance Program. It's all about helping folks navigate Medicare benefits. We're here to provide unbiased and individualized Medicare counseling, assist with appeals, plan comparisons, advocacy, and fraud and abuse prevention. All of our SHIP navigators at Benefits in Action are state and nationally certified counselors and have been through extensive training to provide this service. Let's talk about the basics of Medicare. Different Medicare paths exist within the program. They are defined by their various parts. We're going to talk about Medicare enrollment periods. We're going to talk about the premiums and financial assistance programs that are available to help lower the costs. And we'll talk about Senior Medicare Patrol, which is another phrase describing fraud and abuse prevention. And then we'll talk about how Benefits in Action can help you. What is Medicare and who is eligible? Medicare is a program that is administered by the Centers for Medicare and Medicaid Services, which is a department of the Department of Health and Human Services. It is for those who are 65 years and over, those who have been disabled for 24 months, those with end-stage renal disease, those who have Lou Gehrig's disease or ALS, and those who are legal permanent residents for longer than 5 years and meet one of these other 4 criteria. While CMS administers the program, it is not actually where your Medicare journey begins. You will first sign up with Medicare through either the Social Security Administration or the Railroad Retirement Board. This is due to the fact that Medicare is essentially paid for by our payroll taxes. So payroll taxes are what we contribute towards Medicare for us to receive these services in retirement. So it made sense for the Social Security Administration to be the first stop along the way in order to sign up for your Medicare benefit. Medicare used to use the Social Security number of the individual or the beneficiary to identify themselves on their cards. And obviously with financial exploitation and abuse being more prevalent these days, they have eschewed the Social Security number and have migrated to an alphanumeric randomly generated number to define your Medicare benefits instead of using that Social Security number. If you don't have that new Medicare card and you have been eligible for Medicare for some time, please do contact Benefits in Action. We can make sure that you get that new card directed to you. Let's talk about Medicare and its constituent parts. There are two paths to Medicare: Original Medicare, which is comprised of Parts A, B, and D, and Medicare Advantage, which is Part C. Let's begin first with the Medicare Alphabet. Part A refers to inpatient hospital or skilled nursing facility services. Part B refers to those services received on an outpatient basis at one of those facilities: doctor's office visits, any kind of prevention care, therapies, ambulance, and durable medical equipment. Part C is Medicare Advantage. Part D is your prescription drug coverage. And we'll talk about Medicare Supplements or Medigap policies that help pay for the many Medicare costs that come out of the beneficiaries' pockets. Original Medicare, as stated before, starts with Part A, which is inpatient services, also skilled nursing facility services. Part A is generally free of premium if you have 40 quarters or 10 years of work history in the United States, for which you have paid payroll taxes. Under Medicare Part A, there is a deductible of $1,484 per benefit period. A benefit period is defined as an admission to one of these skilled facilities. The benefit period includes the period of the admission plus 30 days after the admission. Should you be readmitted to a hospital prior to the end of the 30-day benefit period, but for a problem different than the original inpatient admission, that begins a new and overlapping benefit period because you are admitted for a different problem. Admissions are covered with no coinsurance during each benefit period for the first 60 days. There's a $371 coinsurance per day after the 61st, on the 61st day. And then after 90 days, that coinsurance goes up again. And you are tapping into a lifetime reserve of 60 days that is only available. Again, those 60 days are available. They're lifetime reserve days. They're only available for these extended inpatient stays, but only once in your lifetime. After that 60-day reserve is utilized completely, then the beneficiary is responsible for 100% of their inpatient stay beyond the 150th day, if it's one continuous admission, one continuous benefit period. There is no limit to the number of benefit periods in a year. So you could see very quickly inpatient costs becoming quite expensive if you just have Part A without any additional coverage. Part B refers to outpatient services. There is a premium associated with Part B. It starts at $148.50 per month. There is a deductible of $203 per year, so that's an annual deductible, and coinsurance of 20%. Original Medicare also includes Part D for your prescription drugs. Part D plans are purchased directly from insurance companies with an annual premium that averages at about $33 a month this year. The deductible is established at $445 per year, but can be waived by the insurance company should they choose to do so. The coinsurance rate for the initial coverage period is 25%. So you'll still pay 25% of your medication costs for the initial coverage period. At the end of the initial coverage period, which is when the drug costs have accumulated to $4,130, you have reached the donut hole. Previously, when Part D was first introduced, the donut hole meant that at $4,130 in costs to your medications, you were then responsible 100% for the cost of your medications until reaching the catastrophic phase at $6,550. So, Medicare beneficiaries had to be prepared to shell out $2,400 during the donut hole for their medications. The ACA, however, in 2010 began the process of gradually filling that donut hole. So today, the coinsurance rate stays at 25% all the way until you reach the catastrophic phase for brand name drugs. During the donut hole, there's a distinction between brand name drugs and generics become a little bit more expensive for you at 37% coinsurance during the donut hole phase until you reach that catastrophic phase when coinsurance rates go down. So, with those definitions of the costs associated with the various parts of Medicare, it becomes obvious that Medicare is not an inexpensive proposition, which is why a whole series of 8 standardized plans are available to help cover those out-of-pocket costs associated with Parts A and B. These plans are federally regulated, and therefore a Plan A in Maine is the same as a Plan A in Hawaii. These benefit structures are federally mandated and cannot change without federal intervention. The supplements pay as a secondary to your Medicare. They cover those costs such as deductibles and coinsurance or any copayments, but they do not cover copayments or coinsurance associated with prescription drug coverage or Medicare Advantage plans. Medicare supplements can be purchased directly from the insurance company or sometimes through a broker. The premiums are based on age and gender and where you live and a great deal of other data, and are broken down into 3 different rating types. There's attained age, issued age, and community rated plans. And your premiums may go up or down more or less depending on how your premiums are rated under those 3 different mechanisms. I'm not going to go into those details in this presentation. I have a special presentation set up for those that I'll point you to at another time, to review it at another time. These are the average price ranges for these various supplements if you are turning 65 and live in Aurora, Colorado. Just to give you a sense of the premium cost for these various plans. You'll notice a couple of plans, F and C, on this graphic as well as this graphic describing the benefit structure that were not mentioned in the first slide. And that is because F&C plans are no longer available for people who are entering Medicare as new beneficiaries. If you are new to Medicare as of January 1st, 2020, Plan F and C are no longer available to you to purchase. This is due to the 2017 tax restructure bill that was passed under the previous administration that prohibited any plans available as supplements to Medicare to cover the plan, the Part B deductible, that $203 of the Part B deductible. So plans going forward will no longer cover that very first dollar of cost associated with Medicare. So first dollar coverage is no longer available. All plans will at least have that $203 deductible for Part B to come out of the beneficiary's pocket. These plan structures are intricate, and the premiums associated with them change and vary widely. I too have another whole presentation available on supplements available for you to view at another time. The pros and cons of Medigap coverage, the biggest pro obviously is the portability. A Medigap A plan is the same everywhere in the United States. Those benefits do not change. And frequently, most of those plans, you won't even need to intervene in getting the secondary claim process. Medicare just generally passes those claims right along to the secondary for you. So there's no need for referrals to a specialist under any of the Medigap plans. It covers almost all of that 20% regardless of the size of the bill. It covers your Part A deductibles, which, as I mentioned, can stack up and be pretty extensive. And it can even afford you some coverage when you're traveling in foreign countries. The downside, of course, is that you're paying that additional premium on top of your Part B premium. It does not cover any of the out-of-pocket expenses associated with your Part D drug plan. And you are only guaranteed issue for the first 6 months of your Medicare eligibility. What that means is it is only during the first 6 months of your Medicare eligibility that you can sign up for one of these Medigap supplement plans without having to provide any kind of information about your medical history. Providing information about your medical history through providing access to your medical records directly from your doctor's office or filling out health questionnaires, that is called underwriting. Underwriting can reduce your eligibility for certain plans based upon the evaluation of the health insurance company's risk associated with covering you as the beneficiary. So underwriting in general is not something that is going to be an advantageous situation for most Medicare beneficiaries. You're supplying information that will allow them to increase your premiums or potentially even restrict them from offering you a plan altogether. They may elect not to even issue you a plan based on the outcome of the underwriting. So you really do need to view your decision between your paths of Medicare as being something that is once in a lifetime, because it is very challenging to go back to original Medicare and get one of these Medigap policies if you have been on Medicare Advantage, because you are going to go through underwriting. There are rare circumstances where underwriting actually is advantageous. We have an example within our own ranks amongst the volunteers at Benefits in Action, where one of our volunteers was a Medicare beneficiary who, and her insurance company contacted her to go through underwriting. And by doing so, she was actually able to reduce her premiums. But that is a very, very rare circumstance. More than often, underwriting is something that will lead you to have to pay higher premiums or maybe even limit your access to a plan altogether. Let's talk about Medicare Advantage. Medicare Advantage is not subject to underwriting. It's automatically guaranteed issue. They do not cannot rescind coverage or charge you more based on underwriting. Medicare does not fall under that particular rule. It is labeled as Part C, and it really replaces all the benefits available through Parts A, B, and D. However, you still do need to pay your Part B and Part A premiums, if there are any, in order to maintain coverage under Part C. It replaces deductibles and coinsurance with copays for almost all services. It has additional benefits that are not offered through original Medicare, such as some dental coverage, some vision coverage, Silver Sneakers membership for wellness, and non-emergency medical transportation, things of that nature. Some of these plans will have additional benefits in those areas like comprehensive dental coverage or additional vision benefits or better hearing aid coverage if you provide for a rider or an additional premium to your Medicare Advantage plan. The downside that most people find when going with Medicare Advantage is that you are dealing with HMOs or health maintenance organizations that can limit your access to all the physicians that you may want to see, and they're only generally good in the state in which they're issued. There are some PPOs that provide for some out-of-network benefits, and we're going to talk about those distinctions here in this next slide, which is a general kind of how does health insurance work. So the insurance company, or in the case of Medicare, the government, offers you a policy as an individual in return for a premium. You then have access to a defined network of providers, hospitals, pharmacies, and doctors' offices. And that is those providers have relationship with the health insurance company as well, or in case of Medicare, with the federal government through the Medicare fee schedule. So these providers have agreed to accept certain rates from the health insurance company or from Medicare to provide care for the individuals that are within those networks. So there's a lot of money going around in this circle here, or in this triangle. This small network of providers is referred to as an HMO, or in some cases an EPO, an exclusive provider organization. It's where your options for care are limited to a small group of providers. In the case of an HMO, you might be assigned a primary care provider who acts as a gatekeeper to specialty care through the necessity of referrals or prior authorizations. However, the insurance company may have a broader network of providers available on contract as well, and you may have access to those providers should you sign up for a plan labeled as a PPO. Those out-of-network providers, though, will cost you a bit more money in terms of possibly the premium being higher for that policy, or a different structure of benefits, copays and coinsurance rates, etc., and out-of-pocket maximums for those out-of-network providers. Let's talk about how and when we sign up for Medicare. Your initial enrollment period is the 7 months surrounding your month of birth. So you have 3 months before and 3 months after, and the month of your birth inclusive, to sign up for Medicare benefits when you turn 65. It is important to sign up for all parts of Medicare when you are first eligible to do so, because late enrollment penalties are lifetime penalties. They never go away. So signing up for Medicare as soon as you are eligible for whatever parts you want are eligible for is essential in order to uh, avoid those late enrollment penalties that will last your entire lifetime. The open enrollment period for Medicare is annually from October 15th to December 7th. During this open enrollment period, you can evaluate your prescription drug plans to find out if maybe there might be one that is less expensive for you in terms of out-of-pocket costs and the premium. You may also evaluate your Medicare Advantage plan and switch to a different Medicare Advantage plan for the same reason, whether medication costs are less expensive or potentially physician costs or some of those extra benefits as well. That are available through Medicare Advantage plans. Switching from Medicare Advantage to original Medicare, as I said before, is fraught with difficulties in terms of the underwriting necessary for the supplement plans. However, open enrollment time is when you can do that change as well. There are special enrollment periods based on qualifying life events that will afford you a period of time to make changes outside of open enrollment. Moving from one plan service area to another might afford you a 3-month special enrollment period, 1 month prior and 2 months after your move to switch. Moving back to the U.S. from a foreign country or becoming eligible to receive both Medicaid and Medicare affords you a 2-month enrollment period. Leaving coverage from your employer affords you an 8-month special enrollment period where you can sign up for the various parts of Medicare or go with Medicare Advantage. However, leaving coverage from your employer only has a 2-month open enrollment period or special enrollment period for Part D. So Part D has a shorter open enrollment period after leaving employer-sponsored coverage. So if you're going with original Medicare, you're going to want to be on the ball and get in Part D before 2 months have passed. But if you're evaluating Medicare Advantage plans, you have that much longer open enrollment period. And then, of course, switching to a 5-star rated Medicare Advantage plan affords you a special enrollment period any time of the year as well. That is one very rare exception. Medicare has a general enrollment period from January 1st to March 31st annually, and coverage when enrollment is done during that time will begin on July 1st. Again, this is a situation where a lot of people may get caught, and that late enrollment penalty will apply all the way until that July 1st coverage start date in some of those situations. There are times when you would want to consider delaying Part A and B enrollment. Most people don't delay enrolling in Part A simply because it is premium free for most people. So there's no downside to signing up for Part A, even if you are continuing to have employer-sponsored coverage or other form of creditable coverage that you are then using to defer your Part B enrollment. So Part A, when you sign up for it as soon as you turn 65, if you have other coverage, becomes a secondary to that other coverage and can be used if you are inpatient admitted to cover some of the costs that are not covered under your employer-sponsored coverage. Part B. Part B is something that you can defer longer. If you're covered by employer coverage. But COBRA coverage does not count as creditable coverage. So COBRA, if you're going to use it, should only be used for a couple of months after you've left your employer coverage. By the way, an employer coverage for a company that has less than 20 employees is also not deemed creditable coverage. So if you are working for a very small employer, you're going to want to sign up for Part B as soon as you turn 65, because small employer group coverage is not deemed creditable. And like I said, neither is COBRA. So using COBRA to bridge a gap between the end of your employer-sponsored coverage and the start of, say, a Medicare Advantage plan, once you've entered Medicare eligibility then and have signed up for that, is okay. But if you do not sign up within your special enrollment period when you've left your employer insurance coverage, by assuming that your COBRA will cover you, unfortunately, that's just not the case. You will incur a late enrollment penalty if you're relying on your COBRA to be your coverage, and having delayed Part B until like a general enrollment period. So avoid those late enrollment penalties. Don't utilize COBRA as a way to defer your enrollment in Part B when you are first eligible. Only use it to cover a gap. Part B premiums really start at $148.50 this year, but they can go up based upon your income. They use a 2-year look back. So this year's premiums are based on your income from 2 years prior, your 2019 income tax return. Now, some exceptions are available based on some qualifying life events that may help you lower these premiums. Divorces, reduction of hours, loss of job, and other types of events like that can help you lower those premiums. But the more you earn, the higher your Medicare premiums will be. The same is true for prescription drug plan premiums. The general rate is $12.30, but it can get higher based upon your income. And again, the same 2-year look back is applicable. Medicare Advantage costs, again, come in the forms of copays. Most of them do not have additional premiums on top of the Part A and Part B premiums. But the copays can be extensive. Almost every service has a copay associated with it. The copays vary from $0 to $15 for primary care visits, $20 to $60 for specialist visits, and $200 to $300 per day for hospital admissions. There is a point at which you reach what they call a maximum out-of-pocket, at which point there are no more copayments required by your health plan. The general maximum out-of-pocket ranges from $3,400 to $6,700 per year for the HMOs. And for PPOs, that maximum out-of-pocket generally goes up to about $11,000. But your HMO maximum out-of-pocket is embedded within the out-of-network. So your inpatient or your in-network a maximum out-of-pocket costs contribute towards your out-of-network maximum out-of-pocket. And if you would like to learn more about embedded deductibles, I have another video for you to review to learn more about how those work. So what are the major factors when choosing your Medicare path? It really is an evaluation of your comfort level with risk. Medicare Advantage has distinct advantage of lowering your costs when you are healthy, because you're only paying really for the services that you need when you need them. With Medicare and Medigap as a supplement, you're paying premiums for that additional coverage of the out-of-pocket costs associated with original Medicare. So you're paying for things that you may not be utilizing early on in your Medicare journey. But we all know as we get older, our utilization of healthcare services rises. Our medication lists become longer. Our problem list, the list of things that are starting to go wrong, begins to grow. And we will be utilizing more services later in life than we do maybe at the beginning of our Medicare journey. So it's important for you to evaluate whether that long-term prospect of higher utilization is going to balance out well with a Medicare Advantage plan versus Medigap and original Medicare. The benefits of Medigap is that those coverages are standardized by Congress and they don't change very often. However, under Medicare Advantage, they can change benefits and they can change the structure of your copays and costs annually. So things will change much more under Medicare Advantage than things do under Medigap plan. So that's another major factor to help you in your decision making about your Medicare path. There are some mechanisms by which the government can help lower the costs for various aspects of your Medicare coverage, including your Part D and Part C premiums, if you qualify for Extra Help, which is a program specifically for prescription drugs. The litmus test for Extra Help eligibility it goes beyond just income by itself, but also includes an asset test. For an individual who is earning less than $1,630 and has assets under $14,790, that individual will be eligible for partial Extra Help, which lowers that initial coinsurance rate from 25% to 15%, and at the catastrophic phase lowers drug prices down to much lower copayment amounts, or 5% of the drug cost, whichever is greater. However, if your income is much lower than that, all the way down to $1,469 and assets less than $9,470, you are then eligible for full Extra Help, which has then coverage of the entire premiums, the entire deductible, and very, very nominal co-payments throughout the year. In addition to the Extra Help benefits, there are benefits that are available to help cover some of the costs of Medicare Part A and B as well. Those are generally referred to as Medicare savings programs. Medicaid will help with Medicare costs if your income is less than $1,469 per month and assets below $7,970. In those particular instances, they pay the Part B premium. They will also pay any Part A premium that you may have if you do not have sufficient work history to provide for free Part A. It also helps or lowers copays, coinsurance, and deductibles significantly to make Medicare a lot more affordable for those with very low income. The State Medicare Patrol is another term for the group of folks who help people navigate Medicare fraud and abuse. SMP empowers Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. There are 4 R's to fighting Medicare fraud: record, review, report, and remember. Record what occurs during your doctor's appointments. If you don't get a nice document at the end of your visit from your doctor's office stating what has happened during your visit, then you should make a recording of your own. Recording, if you receive an immunization or blood tests that are run, all of those things that happen during that office visit, because you're going to want to review that information with the actual bill that gets submitted by your provider. That information will come to you as either a Medicare summary notice directly from Medicare or as an explanation of benefits document from your Medicare Advantage plan. You want to compare the dates of service and the services that you received on those various dates to be sure that your provider's office has not inadvertently uh, uh, billed incorrectly. If they have, it is not incumbent upon you to be the person to investigate or make a complaint to the provider's office. Um, there is no harm nor foul in reaching out to Benefits in Action at 720-221-8354 to report suspected Medicare fraud. The counselors who are specially certified in the Senior Medicare Patrol can help you discern whether your concerns are worthy of reporting to the Office of the Inspector General. You may go directly to them, though, as well at 800-447-8477 to report your suspected concerns of fraud or abuse. Again, we want to make sure that any incidences of fraud or abuse, whether intentional or unintentional, are reported to keep everybody's costs down. Keeping fraud and abuse down helps reduce cost for everybody. So over-reporting there's just no such terminology. If you have a concern, it's not incumbent upon you to investigate that concern. You should simply report it and let the professionals investigate whether your concern is substantial. Or potentially a pattern might develop with a particular provider. If you're the only person who you're aware of, it doesn't mean that there might not be others who are seeing that same provider who are experiencing the same problem. And reporting that to one place has the greater opportunity for catching those types of issues of multiple fraud and abuse problems. Remember to protect your Medicare number at all costs. Do not exchange your Medicare number for any kind of special offers or anybody who has called you unsolicited. You may reach out to Benefits in Action and we may call you back to help address your concerns, and more often than not, we will need to get your Medicare number in order to do our best job of helping you navigate your benefits available. So in that instance, you were not being solicited, you were not being reached out to by Benefits in Action unsolicited. It was because you reached out to us first that we are going to ask for your Medicare number. And in that situation, that is okay. But if someone calls you without your knowledge, prior knowledge of who they are, and they're asking for your Medicare number, it's always best to protect that and not give that information out. Current scams, there are a great number of current scams in Medicare fraud and abuse. The largest one being free genetic screening if you provide your Medicare information. That one is rampant right now. There are also national advertisements for Medicare Advantage plans that cover your Part B premium. And that really doesn't exist anywhere but a very small pilot program in the South. I believe it's Louisiana, where they're doing a pilot program about covering your Part B premium through Medicare Advantage. It doesn't exist anywhere else. We get a number of calls regarding that. We also have instances of DME companies who are billing and sending braces that aren't needed, as well as fraud and abuse related to power wheelchairs and scooters. Also, an issue where hospice may be utilized for very long periods of time. Hospice is really meant for end-of-life care, something that usually is less than 6 months in duration. So extended periods of hospice benefits can be viewed as potential fraud and abuse. And of course, there's the good old double and triple and quadruple billing of services. All of these are potential fraud and abuse and should be reported as such and allow the professionals then to investigate further. Benefits in Action, again, is here to help you with education, navigation, and application assistance for your medical services. Please reach out to us at benefitsinaction.org or 720-221-8354 for assistance. Senior Medicare Patrol has a special website, smpresource.org, where you can look and see current trends in fraud and abuse scams and reassure yourself that your reporting is indeed a current issue. Medicare can be reached 24 hours a day at 800 Medicare. That's 800-633-4227. And you begin your Medicare journey with Social Security at ssa.gov or 800-772-1213. I'm very glad that you were able to view this education, and we look forward to answering any additional questions you might have by reaching out to us again at benefitsinaction.org, 720-221-8354.